Good morning, Stacy. How are you doing? A little nervous. Well, that's to be expected, especially since you're having surgery this morning. Well, my name is Hollins-Henderson. I am the pre-op nurse that's going to be assisting Dr. Strong in getting you ready for your Mohs surgery. Um, can I get you anything? You seem like you're a little cold, like a warm blanket. You're okay? Okay, great. Um, I would offer you something to drink, but as you know that you have had to be have nothing by mouth since midnight last night, and you followed that doctor's order correctly. Great, great, great. Yes, I know how it is. You want to have your coffee in the morning, and then I'm a person that don't even eat breakfast. I've had about 17 surgeries, but I guarantee you, every time I have to fast for a surgery, that morning I'm starving and I'm not even a breakfast person. Yes, exactly. I see you were diagnosed with basal cell carcinoma about a month ago. Okay. Stacy, you're here for Dr. Strong to perform an outpatient surgery. The surgery you will be having today is Mohs micrographic surgery. Is that correct? Okay. This surgery is to remove the basal cell carcinoma on your left cheekbone. Mohs surgery is the removal of the tumor followed by immediate frozen section histopathologic examination of the margins with subsequent re-excision of the tumor positive areas and final closure of the defect gives the highest cure rates, which is about 98%, and results in less tissue loss. So let me break that down for you. So basically, the doctor's gonna go in and they're gonna shave off the carcinoma that's on your face, and every time they shave it off, they're going to put that on a slide, and the cytologist is going to examine it under the microscope during the surgery, and they're going to examine the margins, and as long as those margins still have cancerous cells, and they will keep going, they'll keep shaving off more tissue. Once they have a positive confirmation that there are no more cancer cells in the tissue, the surgery will be over. Okay, do you have any questions? Okay, great. Stop me anytime if I'm going too fast or if I say a word that you might not understand. Please stop me and feel free to ask any questions. Okay, great. The goal of Mohs surgery delivers the best cosmetic results, the lowest recurrence rate of any treatment method, and the highest chance of complete cure. Basal cell carcinoma is a skin cancer derived from the basal layer or the keratinosis sites of the epidermis, which is the top layer of your skin, is what we call the epidermis, and the keratinocytes are the cells that's under there that can be found when you have basal cell carcinoma. Tumors most commonly are on the sun exposed skin parts of the body, the face, the scalp, ears, neck, and less often maybe the trunk and the extremities. Basal cell carcinoma characteristics can be but are not limited to like a pearly papule, an erythematous patch, so like a reddened patch that can measure more than like 6 millimeters in diameter. It could be like a non-healing wound ulcer in sun-exposed areas, and then it also can have a history of bleeding. Dr. Stephen Strong is the dermatologist who will be performing the surgery, along with Dr. Jeff Hughes, who is the anesthesiologist. Um, and those, Dr. Strong is your surgeon, correct? And all the information I gave you about the surgery is what they had previously went over with you prior to coming here, Stacey, and that's what you expect? Great. Okay, here's some of the specific of the procedures and the instruments used during the Mohs surgery. The procedure entails removing one thin layer of tissue at a time. As each layer is removed, its margins are studied under a microscope by a cytologist for the presence of cancer cells, as I mentioned earlier. If the margins are cancer-free, the surgery is ended. Okay, if not, more tissue is removed from the margin where the cancer cells were found, and the procedure is repeated until all margins of the final tissue sample have been examined and are clear of cancer. In this way, Mohs surgery eliminates the guesswork in skin cancer removal, producing the best therapeutic and cosmetic results. Okay. Um, do you have any questions for me at this time, Stacy? Okay. Did you understand pretty much what I explained about the procedure, what it in details, and how it's going to go? Okay, great. Yes. Okay, you want to talk about how long the surgery will be? Great. Okay, the length of the procedure can vary depending on the microscopic results of the cells being excised from the face, taken out, basically. Even though this process can be a little lengthy, it yields high success rates when it comes to cure rates. So that's the great thing about the Mohs surgery. You have the highest cure rates and success because they're taking the skin off, looking at it all at the same time, and so it eliminates that process of having to take biopsies with your tissue samples, send them off to the lab, wait for the results to come back. So this just eliminates all of that. And like I mentioned earlier, the surgery will conclude once there is no evidence of cancer cells in the margin. There is, it is hard to determine right now what kind of scarring could result from the surgery due to the process of how surgery is conducted. There is a possibility that the incision could be from the medial aspect of the zygomatic, which is your cheek, to the lateral part of the chin. Just remember that the Mohs surgery is the optimal surgery because it spares healthy tissue and only cancer tissue is removed. So just know, no matter what type of incision that you might have, just know that all your healthy tissue was left, and so only the cancer tissue was removed. It is very important that you follow the discharge instructions that the doctor writes. We will give you all these handouts at the end when it's time for you to go. Just kind of go over some things preoperatively. The incision will be closed with stitches, and how many will be determined once the surgery is complete and they've made their final determination that all the cancer cells have been moved. The incision should be kept clean and dry, and do not scratch it. Put any type of lotions, cream, or moisturizers if it itches. Dr. Strong will give you prescriptions for antibiotics and pain medicines, and those we will call into a pharmacy of your choice, so it'll be ready after the surgery. The surgery is a same-day outpatient, and it's important that you have someone to drive you home, as the anesthesia could still be in your system. So do you have someone with you here today, Stacy? Okay, great. Your mom and your sister's in the waiting room. Excellent. Once we get you worked up and get all these questions answered, they'll be able to come back here with you and be with you when the doctor comes in and the anesthesiologist comes in. So just know that your family we will get them shortly, okay? Okay, great. Now, we want you to please notify Dr. Strong's office if the incision becomes red or inflamed, with intense pain, discharge from the incision site, or the incision or the stitches start to come loose. If anything looks different on you, call the doctor's office. We'd rather you be safe than sorry, okay? We would like you to make an appointment with Dr. Strong's office within the next 7 to 10 days to have your incision evaluated and stitches removed. So at this point, do you have any questions for me, Stacy? Okay, great. Have I answered all your questions? Okay, excellent. Well, I know this can be overwhelming, and we've given you a lot of information right now that we've covered in such a short amount of time, and just want you to know that all the information that we went over, along with the list of important numbers, you may need when you go home will be given to you in recovery once you're getting ready to be discharged in a discharge packet we have provided for you. Okay? Okay. We would like to thank you for choosing Henderson Surgical Center, and please let us know if there's anything we can do to make you more comfortable while you're here with us. Excellent. Hello, Stacy. It's Kashaylin again. How are you feeling after your surgery? Not too much pain? Great. A little drowsy. Excellent. Well, the surgery went well. The doctor came out and he spoke to you a little bit ago. You were somewhat alert. He will speak to you again. He's out now in the waiting room speaking to your family. I just kind of want to go over some things with you. You have a cut on your left cheek that's on the left hand side of your face, measuring approximately about 4 inches from your nasal area down to the lower part of your cheek. Your surgery took about 5 hours. Everything went well. There will be, so you will have a scar. Just wanted you to be, from where the incision is, I just wanted you to be aware of that. When you go to your follow-up appointment, you can talk to Dr. Strong if there's any options or things you would like to do to try to, once you're all healed up, if you want to try to maybe minimize the scarring on the face. There's sometimes procedures and things that they can do, okay? Would you, right now, your incision is covered with a bandage, but I want to go over what was going to be up under that bandage. Dr. Strong will come back with further instructions to give you of when he wants you to take the bandage off, what type of wound care he wants you to do until you come back in the office, and plus all those signs and symptoms of infection or things of importance that you need to look for are in the packet as well, and he will also go over those things with you. Okay, well, do you have any questions for me at this time? Your throat is dry. Okay, well, we can give you some ice chips and at this point, and start in a few little bit after some ice chips. You keep those down, make sure you're not nauseated. We'll give you we can give you some Sprite and crackers, put on your stomach, and get you ready and get you recovered and get you out of here to go home and finish recovering in your home. Okay? Okay. You still not having any pain at this moment? Okay, great. If you feel any inkling of pain, please let the nurses know so we can give you something for that pain, okay? Your prescriptions have already been called into the Walgreens on Beltline in Westmoreland, and they'll be ready for pickup once you're discharged, okay? Well, Stacy, thank you again for choosing Henderson Surgical Center to take care of you today. It has been a pleasure, and we would like to wish you a speedy recovery, and please don't hesitate to call us. We gave you a list of numbers in the discharge packet if you have any questions or concerns. Okay, great, wonderful. Have a wonderful day. Thank you.